Hello everyone, this is Dr. Prashanth and welcome back to my public health series. In this video, I'll break down the basics of SPSS in a simple and easy to understand way. Whether you are a beginner or someone who has completed advanced SPSS certifications but still struggles with the fundamentals, this video will help you gain clarity. Always remember, SPSS isn't just about learning the software, it's about understanding the statistical tests and their interpretation. A solid grasp of both theory and practical application is what makes SPSS truly productive. So let's dive in and get started. So first, understand what SPSS is. It's a statistical package for the social sciences, and it is a powerful software used for data analysis, statistical testing, and visualization. It simplifies complex calculations and helps researchers find patterns and trends in the data. It is widely used in health research, social sciences, and business analytics. It provides a very user-friendly interface to manage large datasets and perform statistical tests without any coding skills. Now coming to the uses of SPSS in public health, it helps researchers and professionals analyze survey data, hospital records, disease trends, and health outcomes to improve policies and interventions. To be more specific in relation to public health, in epidemiology, it helps study disease outbreaks, risk factors, and prevention strategies. In hospital management, it helps analyze patient records, treatment outcomes, and resource allocation. In health surveys, it helps process national level surveys like NFHS to study nutrition, maternal health, and child mortality. It helps in comparing the effectiveness of different treatments and interventions in clinical research. It also helps in policy making to evaluate the impact of health programs and design evidence-based policies. So now let's look at some examples. The first example is to analyze smoking habits and their link to lung cancer. Next example, to compare the average blood pressure before and after a new treatment. Other examples include studying the relationship between obesity and diabetes risk and analyzing NFHS data to check trends in child malnutrition. Now let's move on to the next part. Every study follows a structured flow, and that flow begins from questionnaire and data collection, where responses are collected from the sample using a structured questionnaire, which is followed by data entry in SPSS, where the raw data is entered into SPSS for analysis, and then running the statistical tests, where various tests are performed to analyze the data, and finally interpreting the results, which is the final step in understanding and deriving meaningful insights from the output. This structured approach ensures a smooth transition from raw data to actionable conclusions. Let's dive deeper into each step. Before that, let's first have a look at the SPSS interface. Please download the SPSS software before proceeding further. I have given the link in the description. Please download it. So basically, SPSS has two main parts that you will be working with. The first is the menu bar, which is the top panel where you can access all the main functions of SPSS such as file, edit, data, transform, analyze, and many more. So it's like a control center where you can perform all operations. And the second part is the toolbar, which is just below the menu bar, where you will find shortcut icons like open, save, undo, redo, and more. By understanding these two sections, you can quickly get comfortable with the SPSS interface. So now coming to SPSS views, there are two main views in SPSS. The first is the variable view, where you define and format the data set. For example, we will name the variables and set data types and give labels for that. The second is the data view, where you enter and view actual data in a spreadsheet format. So first, we will look at the variable view. In SPSS, the variable view allows you to define and format each variable before entering data in the data view. Let's go through each column available in the variable view. The first is a variable name, where we need to enter the short, unique identifier for the variable. For example, age, income, etc. It cannot contain spaces or special characters. Next is the type of variable, which specifies the kind of data stored in the variable. For example, it's numeric for numbers, string for text, that is alphanumeric, and date for dates. Next is the width of the variable, which determines the maximum number of characters or digits that can be entered. And in decimals, we need to mention how many decimal places should be displayed for numeric variables in the data view. Next is the label, which is a longer descriptive name for the variable that appears in the output tables. For example, instead of age, it will be shown as age in years. That's the name of the label. Okay. Next, coming to the values and value labels, which are very important, we assign meanings to the numeric codes. For example, if it is gender, we will code it as 1 for male and 2 for female. And in the missing values, we need to specify values that should be treated as missing data. Usually it's 99 for missing responses. And the columns define the width of the column in data view, affecting how much space the variable takes in the data view. So any change done here will get reflected in the data view. Next is alignment, which controls how data is aligned in data view. For example, we can set it to left, center or right, whereas the measurement determines the level of measurement for the variable. So it is very important to understand the levels of measurement in SPSS. First is the nominal variable, which is categories with no order. For example, male and female, that is gender. Next is ordinal, which is categories with a meaningful order, that is education level. For example, primary, secondary, higher education, like that. Okay. And now coming to scale, which includes continuous numeric values. For example, age, 25 years, 26, 27, etc. And now coming to the last column name, which is role, which specifies how the variable is used in analysis. For example, input, target, both, none, etc. So it is mostly optional for basic SPSS use. And now coming to SPSS data types, SPSS mainly categorizes data into two main types. The first is string data or textual data, which stores text values like name of the participant, address, IDs, etc. The second is numeric data, which stores numbers and can be further classified as nominal, ordinal or scale. And always remember, in SPSS, numeric refers to data storage, that is how the data is stored in the SPSS. While measurement level, that is nominal, ordinal or scale, it defines how the data is interpreted. And now let's understand this practically with a simple example of a public health survey. A survey was conducted with 10 participants to study health behaviors and risk factors. The questionnaire collected data on the following variables. First is demographic information like unique ID, age, gender, etc. So if you look at the gender, it is coded as 1 and 2. So numeric type in SPSS, but the measurement is nominal, okay, because it's a categorical variable. Similarly, under health indicators, you can see BMI category with value labels and there is an order for that, right? So the data type in SPSS is numeric, but the measurement scale is ordinal. And now coming to smoking habits and vaccination status, these two are nominal because these are yes or no type of responses. And the last question, that is about past medical conditions like diabetes and hypertension, it is an open-ended textual question. So in SPSS, the data type should be string and the measurement should be no measurement because this is a string type of variable. Now let's start entering data in SPSS. First, we need to enter all the variable names in the variable view and fill all the relevant columns that we have discussed before. For example, starting with the ID, SPSS data type is string and the measurement level is nominal. So in this case, I have took it numeric because all my ID numbers are 1, 2, 3, 4. So basically it will be something like P001, P002. It's a mixture of both alphabetics and numbers, but for time being, I have selected randomly 1 to 10 and set the decimal to 0. And now coming to the label, we already know, right, it's the longest form of the variable name. In this case, it is the unique respondent's ID and no value labels are needed for ID. Similarly, fill in all the other variables. For example, for age, the SPSS data type is numeric and the measurement is scale. For gender, it's numeric type in SPSS and the measurement is nominal. But we need to value label the gender, right? We need to give coding for the gender. So it's basically 1 for male and 2 for female. So you need to click on the 3 dots in the value field and enter 1 in the value and male in the label. Similarly, 2 in the value field and female in the label. Then click on OK. Similarly, you can add value labels to BMI category, smoking status and vaccination status. For example, for BMI, 1 is underweight, 2 normal, 3 overweight and 4 is obese. For smoking status, SPSS data type is numeric and the measurement is nominal and the value labels are 0 for non-smoker and 1 for smoker. For vaccination status, which is again numeric and nominal, and the value labels include 0, no, 1 is for yes. And now for disease history, which is a textual open-ended type response, the SPSS data type is string and the measurement is nominal. Now we are done with the first step of data entry in SPSS, right? That is in the variable view. Next, we need to move to the next part, which is the data view, where we need to enter individual participant responses in the relevant variable fields. For example, if the survey is done on 10 individuals, enter the data clearly under each variable for each participant. As we have already assigned value labels, you don't need to enter the full value name, okay? Instead, the code number should be entered. For example, instead of entering male in the data view, we will just enter 1. For female, it's 2. Now we are done with the entries in both the variable and data view of SPSS. To analyze the data, simply click on the Analyze button in the menu bar and select the test you want to perform. So we will discuss about the statistical tests in the coming part of the video. For time being, I hope you are clear with how to open SPSS, enter data in the variable view and enter data in the data view. So now let me show you some real survey questions. I have selected some random questions from a child health survey. Please try to understand how to identify the data type and measurement scale. So the first question, this is being asked to a mother, okay? What was your age when you gave birth to your child? So age is a continuous numerical variable, right? So SPSS will store this question in the form of numbers only, because the answer should be something like 18 years, 19 years, 25 years, right? So SPSS data type should be numeric and the measurement level is scale because it's a continuous variable. And now coming to the second question, where was the child born? But this is not a open-ended question, okay? Because they have given coding in the question itself. If the child was born at home, it is 1, and if the child was born at subcenter, the code is 7. So basically, SPSS data type is numeric because the answers are stored in the form of numbers, and the measurement level is nominal because there is no order for this, right? So 1, 2, 3, 4 till 9, there is no specific order for this. So measurement level should be nominal, SPSS data type should be numeric. And now coming to the next question, how many siblings does your child have? Again, they are asking some number, right? So SPSS data type is numeric and the measurement level is scale because it is a continuous variable. The answer should be something like 1, 2, 3 or 4 siblings, right? So it's a continuous numeric variable. So measurement is scale, but SPSS will also store this data in the form of numbers. So SPSS data type is also numeric. And now coming to the next question, how often does your child fall sick in a year? Again, the SPSS data type is numeric because the answer should be something like 1, 2, 3, right? But they have not made it as an open-ended question. If you see in the question itself, there is a coding for this. If it is less than 3 times, the answer is 1. If it is 3 to 5 times, the code is 2. 6 to 8, it's 3, and more than 8 times, it's 4. So basically, SPSS is storing the answer in the form of numbers again. So SPSS data type should be numeric, but the measurement level, if you clearly observe, there is a ranking for this, right? Because less than 3 times is less than 6 to 8. And 3 to 5 times is also less than 6 to 8. And 6 to 8 times is less than more than 8 times. So there is a proper order in this case. So measurement level is ordinal and SPSS data type should be numeric because it is saving the data in the form of 1, 2, 3 and 4. Okay, only 4 numeric values. Now I hope that there is no confusion in understanding data type, measurement scale and value labels. So before talking about statistical tests, there are some important terms to understand. First is dependent variable, that is the outcome you are going to measure in a study. Next is independent variable. It is a factor that influences or affects the dependent variable. Next is null hypothesis, which assumes that there is no effect or no difference between groups. And the alternative hypothesis assumes that there is an effect or difference between groups. And now coming to p-value, it is the probability of obtaining results as extreme as observed, assuming the null hypothesis is true. And if the p-value is less than 0.05, we reject the null hypothesis, right? And we call it as statistically significant. And if the p-value is more than 0.05, we fail to reject the null hypothesis and we call it as not significant. And now coming to discrete variable, it is a variable that takes only specific separate values with no intermediate values. For example, the number of hospital admissions per day. So the answer should be something like 5 or 6 admissions, right? It cannot be 5.5 admissions, right? And now coming to continuous variables, numeric values with meaningful intervals. For example, weight and height are continuous variables. And now coming to categorical variables, data divided into groups. For example, male and female, that is gender, and disease status, present or absent, or it can be yes or no. And now coming to normal distribution, a bell-shaped curve where most values are centered around the mean. So parametric tests are something we use when there is a normal distribution. Non-parametric tests are used when data does not follow a normal distribution. I hope this is clear. And now let's move to the next part. It is very important to understand the concept of each statistical test and when to use it. Always remember that SPSS is a tool for analysis and you need to know which test has to be used and why. I'll make it simple. I will explain some important tests that are used in biostatistics. First is descriptive statistics, that is used for summarizing data, and it includes frequencies and percentages, mean, median and mode, standard deviation and variance. And now coming to tests for difference between groups, we use independent sample t-test to compare means between two groups. And we use paid t-test to compare means before and after an intervention. So that is in the same individuals. And now coming to the third type, that is ANOVA, that is analysis of variance. It is used to compare means across 3 or more groups. And now coming to tests for relationship between variables. First is chi-square test, that is used for categorical variables to check associations. Next is correlation. It measures the strength and direction of relationship between two variables. And the next one is regression analysis, which predicts the effect of one or more independent variables on a dependent variable. And now coming to non-parametric tests, which are used when the data is not normally distributed. First is Mann-Whitney U-test. It is an alternative to the independent t-test. Next is Wilcoxon-Sain rank test, which is alternative to paid t-test in case of non-normal data. And the last one, that is Kruskal-Wallis test. It is alternative to ANOVA in case of non-normally distributed data. And now coming to the last category, that is survival analysis. The first test is the Kaplan-Meier curve. So it estimates survival probabilities over time. Next is Cox regression, which examines the effect of multiple variables on survival time. So for better understanding, let's group them with a proper flow. First, under descriptive statistics, we can see, as already discussed, it includes mean, median and mode, right? And under comparing two groups, it includes both parametric and non-parametric. First is independent t-test, followed by paid t-test, Mann-Whitney, Wilcoxon-Sain rank test. And under comparing more than two groups, one is ANOVA in case of normal distribution. In case of non-normally distributed data, we use Kruskal-Wallis test. And now coming to the fourth one, that is association between categorical variables, we use chi-square test. And under correlation, we can see two types, that is Pearson correlation and Spearman correlation. And now coming to next part, that is regression analysis. Under regression, we can see linear, multiple and logistic regression. And now coming to the last category, that is survival analysis, we use Kaplan-Meier test and the Cox regression. So we will follow this sequence. We will conduct each test in SPSS and then I will try to interpret the data. So now let's start with the descriptive statistics. We all know that it is used to summarize and describe the main features of a data set. A simple example, a researcher collects data on the vaccination status of 10 children. So the first step we need to do is open the variable view in the SPSS. Then enter the variable names and select SPSS data type, whether it's string or numeric. Then set the decimal to 0 if not needed and enter the label name. For example, for ID, the full name should be something like unique participant identifier. Okay. And now in the value labels, we need to code the vaccination status. So click on 3 dots and give coding for vaccination. 1 for vaccinated and 2 for unvaccinated. And then for the measurement scale, it is nominal for both ID and the vaccination status. And set the alignment to center. Now click on data view, enter data of 10 participants and enter their vaccination status in terms of 1 or 2. 1 for vaccinated and 2 for unvaccinated. Then click on analyze, select descriptive statistics, then select the frequencies and select the vaccination status and pull it to the variable box. Then click OK and you will get the results. So now let's try to interpret the results. So it's very clear that 60% of them are vaccinated and 40% are unvaccinated. So descriptive statistics provides a basic overview but does not indicate significance or association with other variables. So now let's move to the next test, that is independent t-test. And we know that independent t-test is used to compare the means of two independent groups. A simple example, comparing BMI between smokers and non-smokers. So these are the two groups. So the first step in SPSS is to select the variable view, enter variable names and set the decimals. For BMI, as the scores are collected in decimals, we will put the decimal to 2 and give label names, for example for participant ID, smoking status, body mass index, that is kg per square meter. So that's the full description of the variable name. And now add value labels for smoking, that is 1 for smoker and 2 for non-smoker, and select the measurement scale. For ID and smoking status it's nominal, but for BMI it is continuous variable, right? Because body mass index is a continuous numerical variable. And then set the alignment to center, click on data view and enter all the data. And now click on analyze, select compare means and then select the independent sample t-test. Select the BMI and pull it to the text variable box and the smoking status to the grouping variable box. And then define grouping variable, that is smoking status, right? Group 1 is 1, that is smoker, and group 2 is 2, that is non-smoker. Then click on OK and you will get the results. So now let's try to interpret the independent t-test result. So first, in the group statistics overview, you can see that for smokers, the average BMI mean is 26 and with a standard deviation of 0.97. For non-smokers, the average BMI is 22.70. So that is less than the smokers, right? And the standard deviation is 0.72. So this tells us that on average, smokers have a higher BMI than non-smokers. Now moving to the independent sample test table, the first part is Levin's test for equality of variance. So this test checks whether the spread or variability of BMI scores is about the same in both groups, that is smokers and non-smokers. So the p-value in this case is 0.385. So that is not significant and we accept the null hypothesis, right? So which is more than 0.05. So that means we assume equal variances between the groups. So in this case, we need to use the first row of the t-table for our analysis. Now look at the t-test for equality of means row. So that is the first row. In this case, the t-value is 6.076 and the degree of freedom is 8 and the p-value is something 0.000, which is less than 0.05. So since the p-value is less than 0.05, it means the difference in BMI between smokers and non-smokers is statistically significant. And the mean difference is 3.3, which means that smokers on average have a BMI that is 3.3 points higher than that of non-smokers. And now coming to the confidence interval, that is 95% confidence interval is from 2.05 to 4.55. So that means we are quite confident that the true value lies within this range. What is the range? Lower limit is 2.05 and the upper limit is 4.55. So to conclude, there is a significant difference in BMI between smokers and non-smokers, and smokers tend to have a higher BMI. Okay, I hope it's clear. So now try to understand this result and interpret. So if you look at the first table, it is the statistics, okay, group statistics. So where you can see the mean and standard deviation. So in the intervention group, the mean is 20, and in the control it's 14. So there is a significant decrease in the mean from 20 to 14.2. And in the second table, that is the independent sample t-test, the t-value is 2.485, whereas the p-value is something 0.014. So that means it is less than 0.05 and there is sufficient evidence to reject the null hypothesis and accept the alternative hypothesis. So what does it mean? There is a difference in mean ulcer-free weeks between the intervention and control groups. So the 95% confidence interval for the difference suggests that patients in the clinic group have between 1.2 and 10.5 more ulcer-free weeks than patients in the control group. So don't worry about the variable names, okay? So I'm trying you to know how to find the p-value and how to interpret the result, okay? So now coming to the next test, that is paid t-test. So we use paid t-test to compare the means of the same group before and after an intervention. A simple example, measuring cholesterol levels before and after a 3-month intervention. So we are trying to compare it on the same sample, okay, before and after. So the first step in the SPSS is to select the variable view and enter the variable names, okay, and select the SPSS data type, decimals and value labels, and also the measurement type. Okay, so measurement is nominal for ID, but for cholesterol levels it's scale. Why? Because the cholesterol level is something continuous numeric variable. Okay, 120, 195, 200 something. Okay, now click on data view and enter all the data. Click on analyze, select compare means, then select paid sample t-test, and now pull cholesterol levels before and after variables to paired variable box on the right side. Then click on OK and you will get the results. So now let's try to understand the result. The mean cholesterol level before the intervention is 215 and after the intervention it drops to 195. So there is a reduction in cholesterol levels after the intervention, right? And now coming to the next table where you can see the correlation value, that is 0.845. So that means there is a strong positive correlation between the two measurements. And if you look at the p-value, that is 0.002, which is less than 0.05, right? So it is statistically significant. So now let's look at the paid sample test table. So to see whether the reduction in cholesterol is statistically significant. So we already know that the mean difference between before and after is 19.5 milligrams per deciliter. That means cholesterol levels dropped by an average of 19.5 points. So the t-value is 12.4 and the p-value is something 0.000, which is less than 0.05. So we can conclude that since the p-value is very low, that is less than 0.05, the cholesterol levels significantly decreased after intervention. So this means the reduction is not due to chance, but the intervention was effective. So now let's try to understand this table. So if you look at the p-value, it is 0.012. So that means the result is statistically significant. And if you look at the confidence interval, the range is between 1.7 and 12.9. So health related quality of life has declined over time from a mean of 66.3 at baseline to 58.9 at 3 months. Okay, that is the interpretation. And now coming to the next test, that is Mann-Whitney U test. So it is alternative to independent t-test in case of non-normally distributed data. Okay, so simple example, stress levels in healthcare workers. Okay, in one column you can see the location of the workers and the next column you can see the stress score from 1 to 10. So the first step we need to do in SPSS is select the variable view, enter all the variable names and also select the measurement scale, click on data view, enter all the data. Then click on analyze, then select the non-parametric test because the data is not normally distributed. Then select the legacy dialogues, then select two independent samples. Then we need to pull the stress codes to the test variable list and we need to pull location variable to grouping variable. But now we need to define groups again. Group 1 it is 1 and group 2 it is 2. Then click on continue and then you need to tick the Mann-Whitney if it is not checked. Then click on OK and you will get the results. So now let's try to interpret the results. So the Mann-Whitney test was conducted to compare stress scores between the health workers in urban and rural locations. So that is 1 for urban and 2 for rural. Okay. So the result shows a significant difference in stress levels between the two groups. How? Because the p-value is 0.014. which is less than 0.05. So the stress levels in urban healthcare workers are significantly higher than those in rural workers at the significance level of 0.05. So what does this analysis suggest us? It says that urban healthcare workers experience significantly higher stress levels compared to the rural healthcare workers. Okay. And now coming to the next test, that is Wilcoxon sign rank test, which is also again a non-parametric test and it is alternative to paid t-test. Okay. So we need to do the test on the same sample. A simple example. Let's assume we are measuring stress scores before and after an intervention. So the first step in the SPSS is to select the variable view, enter all variables and select the type of data, put the decimals, label, give value labels for that. Okay. Then now coming to the measurement scale, for ID it's nominal, for before test score it's ordinal and also for after test score it's ordinal because it's a score from 1 to 10, right? So there is some order, right? Then select the data view and enter all the data. Click on analyze, select non-parametric test, then select related samples, then click on fields and pull the stress scores before and after to the test field box. Then click on settings, then choose the test manually by clicking customize test button. Then you need to select Wilcoxon matched pair sign rank test. Then click on run the test and you will get the results. So now let's try to interpret the results. So first we'll look at the null hypothesis. Okay, the null hypothesis states that there is no difference in the median stress scores before and after the intervention. The Wilcoxon sign rank test gave us a significance value, that is p-value of 0.004. So which is below 0.05. So we can say that this is statistically significant. Okay, since the p-value is 0.004, which is less than 0.05, we reject the null hypothesis and conclude that the intervention significantly reduced stress scores in the participants. So now coming to the next test, that is comparing more than two groups. So we use ANOVA test, that is analysis of variance. A simple example, comparing mean systolic blood pressure among three diet groups. Okay, so there are more than two groups now, vegetarian, mixed and non-vegetarian, and we are trying to compare the mean systolic blood pressure. So the first step we need to do in the SPSS is to select the variable view, enter all the variable names, select the data type, decimals, label names, and also give value labeling. Okay, in this case we need to give the coding for diet group, 1 for veg, 2 for mixed and 3 for non-veg. Then we need to select the measurement scale. For ID we know it's nominal, for diet group it's nominal again because there is a coding 1, 2, 3 and there is no order. And now coming to the blood pressure, which is a continuous numeric variable. So the measurement scale should be scale. And now click on data view, enter all the data of the 10 participants, then click on analyze, select compare means, then select one-way ANOVA, then pull the blood pressure variable to dependent variable box and diet group to the factor box. Then click on options, select descriptive, click continue and then click on post hoc, then select Tukey and Bonferroni. Okay, then click continue, then click OK and you will get the results. So now let's try to interpret the results. So first we will look at the descriptive statistics. So it clearly shows us the mean blood pressure for vegetarian group is 120 mm and for mixed diet it's 130 mm and for the non-vegetarian it is 141. Okay, and now coming to the ANOVA test, the p-value is 0.000, so which is less than 0.05. So this suggests that there is a statistically significant difference in blood pressure among the three diet groups. Okay, and now coming to the next test, that is post hoc results, that is Tukey and Bonferroni. So it shows that the vegetarian group had significantly lower BP compared to both mixed diet and non-vegetarian groups. And similarly, the mixed diet group also had significantly lower BP compared to the non-vegetarian group. All main differences are statistically significant. What does it mean? All the values, all the p values are less than 0.05. Okay, it confirms that diet type significantly influences the BP levels. And now coming to homogeneous subset analysis, this categorized the diet groups into different blood pressure levels. Vegetarians had the lowest BP, mixed diet individuals had intermediate BP, and the non-vegetarian had the highest BP. So let's conclude this. It shows a strong association between dietary habits and the blood pressure levels. And the vegetarians tend to have significantly lower systolic blood pressure compared to individuals who follow a mixed or non-vegetarian diet. And the non-vegetarians exhibit the highest systolic blood pressure, suggesting that high meat consumption might contribute to increased blood pressure levels. So now coming to the next test, that is Kruskal-Wallis test. It is used to compare differences between more than two independent groups. So it is something alternative to ANOVA in case of non-normally distributed data. So a simple example, it's similar to the previous one, but we will add one extra group. Okay, so before it was only urban and rural, right? So now we will add one more group, that is suburban. So now in the first step of SPSS, we need to enter all variables in the variable view, select the type, decibel, labels, and in the value label section, we need to add one more extra code, that is 3. So 1 is for urban, 2 is for rural, and 3 is for suburban. Then we need to select the measurement scale. For ID it's nominal, for location also it's nominal. For stress scores we know it's ordinal because it's in a score level of 1 to 10. Then click on data view and enter all the data of the 15 participants. Click on analyze, then select non-parametric, then select legacy dialogues, select K independent samples. Okay, then tick the Kruskal-Wallis test. Then we need to pull the stress scores to the test variable box and we need to pull the location to the grouping variable. Then click on define the range. Okay, so it is nothing but the minimum and maximum range. For example, in this case there are three groups, right? Urban, rural and suburban, and the coding is 1, 2 and 3. So the minimum range in this case should be 1 and the maximum is 3. Then click on OK and then you will get the results. So now let's try to interpret the results. Let's talk about null hypothesis first. Okay, the null hypothesis states that there is no difference in median stress scores among the three groups, urban, rural and suburban. And the mean ranks of stress scores are something like 11.2 for urban, 4 for rural and 8.8 for suburban. And if you look at the chi-square value, the p-value is 0.030. So which is again less than 0.05. So we can say since the p-value is 0.030, which is less than 0.05, we reject the null hypothesis and conclude that there is significant difference in stress levels among urban, rural and suburban healthcare workers. Okay, and then post hoc analysis would be required to determine which group differs significantly from each other, whether it's urban, rural or suburban. And now coming to the next test, that is chi-square test, which comes under the association between categorical variables. So it is used to test the association between two categorical variables. And the type of data is something both dependent and independent variables are categorical. Okay, a simple example, examining the association between exercise and hypertension. Okay, so both are categorical variables. That means yes or no type of responses. So the first step we need to do in SPSS is select the variable view, enter variable names, select the data type, set decimals, enter the label names and also value labels for exercise status and hypertension. For example, 1 for yes and 2 for no. Then set the alignment to center and then select the measurement scale. It is nominal for all the three variables, ID, exercise status and hypertension. Okay. Then click on data view and enter all the data. Click on analyze, select descriptive statistics, then select the cross tabs. Then we need to pull the exercise status variable to rows and hypertension status variable to columns. Then click on statistics, then select the chi-square test, click on continue and then select the cells. So here we need to select expected cells as well. Okay. Then click on continue, click OK, then you will get the results. So now let's try to interpret the results. So first let's start with the cross tabulation. It is very clear from the results that all 5 individuals who exercise do not have hypertension and all 5 individuals who do not exercise have hypertension. So what does it indicate? It suggests that a strong inverse relationship between exercise and hypertension. And now coming to chi-square test results, the Pearson chi-square value is 10 and the p-value is 0.002. So which is statistically significant. But in this case, all the expected counts in the chi-square table are less than 5. So if the expected counts are less than 5, we need to look for the Fisher's test. Okay, that is Fisher's exact test. So for that the p-value is 0.008, which is again less than 0.005. So it is also statistically significant and we reject the null hypothesis and we conclude that there is a significant relationship between exercise and hypertension. So finally we can conclude that individuals who exercise are significantly less likely to have hypertension, or those who do not exercise are significantly more likely to have hypertension. So always remember, if the expected cell counts are more than 5, then we need to look at the Pearson chi-square. If it is less than 5, we need to look for the Fisher's exact test value. Okay. So let me explain the difference between cross tabs and the chi-square test. Okay. Cross tabs simply create a table that displays the relationship between categorical variables. So it shows the counts and percentages. Okay. Whereas chi-square test, it is a statistical test which is used to determine if the association between the two variables is significant or just due to chance. So this test provides a p-value. So based on p-value, if it is less than 0.05, we conclude that it's statistically significant. Okay. So in simple terms, cross tabs help to summarize the data, while the chi-square test helps us to validate the relationship with the statistical evidence. So now let's try to understand this result. So if you look at the first table, it is the cross tabulation where you can see the number and the percentages. Okay. It's simply summarizing the data. And now coming to the chi-square test, if you look at the expected cell count in this case, it was mentioned that the minimum expected count in this case is 18.91. So that is more than 5. Okay. So if it is more than 5, we need to check for the Pearson chi-square test. So the Pearson chi-square test significance value is 0.5. So 0.5 is something more than 0.05, right? So in this case, it is statistically not significant. And in the same case, if the expected cell count is less than 5, then we need to look for the Fisher's exact test. Okay. Then we need to look for the p-value that was provided by the Fisher's test. Okay. I hope it's clear. And now coming to the next topic, that is correlation and linear regression. First, we will talk about the correlation. In correlation, we are looking for a linear association between two variables. And the strength of association is summarized by the correlation coefficient. The square of the correlation coefficient gives the proportion of the variation of one variable explained by the other. It is R square. Okay. And in regression, we are looking for a dependence of one variable, that is usually the dependent variable, on another independent variable. In linear regression, the dependent variable is continuous, whereas in logistic regression, it is binary. And the relationship is summarized by a regression equation consisting of a slope and an intercept. In linear regression, the slope represents the amount the dependent variable increase with unit increase in the independent variable. And the intercept represents the value of dependent variable when the independent variable takes the value 0. In logistic regression, the slope represents the change in log odds for a unit increase in the independent variable. And the intercept, the log odds when the independent variable is 0. And now coming to multiple regression, it is interested in the simultaneous relationship between one dependent variable and a number of independent variables. So first we will look at the correlation. So under that, the first test is Pearson correlation. It is used to measure the strength and direction of a linear relationship between two continuous variables. Okay. So first I will take a very simple example. We are trying to check if physical activity is related to body mass index. Okay. So the first step in the SPSS is to click on the variable view, enter all the variable names, then select the measurement scales, and then click on the data view and enter all the data. Then click on analyze, select correlate, select bivariate. Then we need to pull the physical activity and BMI to variable box and then tick the Pearson test. Then click on OK and you will get the results. So now let's try to interpret the results. So if you can look at the result, the Pearson correlation coefficient is something minus 0.983. So this indicates a strong negative correlation between the two variables. For example, if the physical activity is increased, the BMI tends to decrease significantly. So now we will look at the p-value also. It is something 0.000, which is less than 0.05. So we can say that it is statistically significant. Okay. And now coming to the next stage, that is Spearman correlation. It is used to measure the strength and direction of a monotonic relationship between two variables. It is used when the data is not normally distributed. A monotonic relationship is nothing but if one variable increases, the other consistently increases or decreases, but not necessarily at a constant rate. So I took a very simple example. So we'll try to check if socioeconomic status is related to hospital visits per year. So the first step we need to do in SPSS is to select the variable view, enter all the variable names, select type, decimals and label names. Then we need to do the value labeling, right? For socioeconomic status, the coding is 1 for low, 2 medium and 3 is for high. Then we need to select the measurement scale, nominal for ID, and for socioeconomic status, we can see a order, right? There is some ranking. So it is ordinal in this case. And the hospital visits per year is something continuous variable in this case. So the measurement type should be scale. Then click on data view, enter all data, select correlate and then select the bivariate. Then we need to pull the socioeconomic status and hospital visits to the variable box. Then we need to tick the Spearman, then click on OK. You will get the results. So if you can look at the result, the Spearman's coefficient is something minus 0.944. So that indicates a strong negative correlation again. So this suggests that individuals with higher socioeconomic status tend to have fewer hospital visits per year, and while those with lower social economic status tend to have more frequent hospital visits. Okay, so if you can look at the p-value, it is 0.000. Again, it is less than 0.05, right? So the test is statistically significant. So now coming to the next test, that is regression analysis. So there are three types in this. One is linear, logistic, and multiple regression. So first I will start with linear regression. Linear regression is used to assess the relationship between a continuous dependent variable and one independent variable. So a simple example, predicting blood pressure from age. So age is a continuous variable, okay, and blood pressure is also a continuous variable. So the first step we need to do in SPSS is to click on variable view, then enter the variable names, select the data type, measurement scale, everything. Then click on data view, enter the data, click on analyze, select regression, then select linear, and then we need to pull age to the independent variable box and the blood pressure to the dependent variable box. Then click on statistics, select the confidence intervals, R2, estimates, and model fit. You can also change the confidence interval if you want to change it. Then click on continue, then click OK, then you will get the results. Let's try to interpret the results. So first, if you look at the model summary, the R-square value is something 0.995. So what does it mean? 99.5% of the variation in blood pressure can be explained by age. So which indicates a strong relationship. And if you can look at the p-value of the ANOVA table, it is less than 0.001. So that means it is statistically significant, and also mean that age is a strong predictor of BP. And now if you can look at the coefficients table, the B value or the slope for age is 1.03. So what does it mean? Every 1 year increase in age, the blood pressure increases by 1.03 mm of Hg on average. And if you can look at the intercept, that is 85.36. So what does it mean? When the age is 0, the predicted blood pressure should be something 85.36. And now coming to the next stage, that is multiple regression. So it is used to examine the relationship between one continuous dependent variable and two or more independent variables. So in this example, the independent variables are monthly income, education in years, and physical activity. And the dependent variable, that is the continuous dependent variable, is the body mass index, that is BMI. So the first step in SPSS is to select the variable view, enter variable names, data type, decimals, and also select the measurement scale. Okay. Then click on data view, enter all data, click on analyze, select regression, and again select linear. Then we need to pull the BMI to dependent variable box and remaining to the independent variable box. There are three independent variables, right? Then click on statistics, select CI, that is confidence interval, then collinearity diagnostics, then click continue, then click OK. Then you will get the results. So now let's try to interpret the results. So if you can look at the first summary, that is model summary, the R-square value is something 0.994. That means 99.4% of the variation in BMI is explained by the independent variables. And now coming to the ANOVA table, the p-value is 0.000. So which is less than 0.05, right? So that means the model is statistically significant, meaning that at least one predictor significantly influences the BMI. So to know which variable or which predictor, we need to look at the coefficients table. So for example, if you look at the p-values for physical activity, education, and monthly income, for physical activity, we can see there is significance because the p-value is 0.005, which is less than 0.05. But for education, if the p-value is something 0.660, which is not statistically significant because it is more than 0.05. And similarly for monthly income, the p-value is 0.972, again more than 0.05, statistically not significant. And now coming to the next important part of the result, that is collinearity diagnostics. It is nothing but it is used to check whether the independent variables are highly correlated with each other. So what are the independent variables in this study? It is physical activity, education, and income. So to check whether these are correlated with each other, we use a test called collinearity diagnostics. Okay. So there is one measure for this, that is VIF. That is variance inflation factor. So if the variance inflation factor is more than 10, then we can say that there is multi-collinearity. That means the variables are too similar and can mess up with the results. Okay, so in this case, if you can see the VIF values for education and income, they're 120 and 97, which are too high, right? So that means they're strongly related, which could distort the analysis. And also for physical activity, the VIF is 36, which is also more than the normal range, right? So these things might be happening because the sample size is very small, because I took these examples for helping you. That's it. Okay, don't go with the deep understanding of the interpretation. As the sample size is small, definitely there will be issues like this. Okay, so don't worry about that. Try to understand when to use a test, how to run the test, and how to interpret the results. Okay. So to conclude this thing, physical activity is the only significant predictor of BMI. More physical activity leads to lower BMI. That's all. Okay. Whereas education and income do not significantly affect the BMI because the P values are something more than 0.05. And now coming to the next test, that is logistic regression. It is used to assess the relationship between a categorical binary dependent variable and one or more independent variables. A simple example, predicting diabetes risk, that is yes or no, that is binary categorical variable, okay, based on BMI, which is a continuous variable again. So the first step in SPSS, to click on variable view, enter variable names, data type, decimals, label names, set the alignment and also the measurement scale. So the measurement scale in this case is, for ID it's nominal, for BMI we know it's a continuous numerical variable, so the scale should be scale, and the nominal for diabetes status. Why? Because we are coding it like 0 for no and 1 for yes. Then click on data view, enter the data, click on analyze, select regression, then select binary logistic. Then we need to pull the diabetes status to dependent box and BMI to covariate box. Click options and check if required fields are checked. Then click on continue, click OK, then you will get the results. So now let's try to interpret the results. First we need to check the variables not in the equation. So they have mentioned that BMI is statistically significant, but it was not in the final model summary. So this is something which is happening because of the small sample size. Okay. So now you need to check it the second test, which is very important, that is omnibus test for model coefficient. So if you can look at the p-value, that is 0.002, which is less than 0.05. So we can say that it is statistically significant. And now coming to the next part of the model, that is model summary. It is nothing but it measures how well the model explains the data. So if you can look at the R-square value, it is 0.857, right? That means 85.7% of the variance in diabetes status is explained by the BMI. Okay. And now coming to the next important part of the test, that is Hosmer and Lemichaud test. It is also called goodness of fit. So if you can look at the chi-square value, it is 2.5, okay. But if you can look at the p-value, it is 0.957. So it is more than 0.05. So that means we are going to accept the null hypothesis, right? So in this case, if the p-value is more than 0.05, then it indicates that the model fits the data well. Or in other words, our model's predictions are close to the actual data. So it is quite opposite to the statistical significance. Okay. So if it is more than 0.05, we accept the null hypothesis. So we assume that there is no difference. So our model's predictions are close to the actual data. And now coming to the next part, that is logistic regression coefficients. So if you look for the BMI, the B values is 2.308. P is 0.320 and the exponential of B is 10.050. So what is exponential of B? So it is nothing but the odds ratio. So if the exponential of B value is 10.05, it suggests that for unit increase in BMI, the odds of diabetes increase is 10.05 times. But the p value is more than 0.05. So that is statistically not significant. So that indicates that BMI's effect may not be statistically strong in this sample. And now coming to the next part, that is intercept, the B value is minus 64. So it is negative, right? The negative coefficient suggests that at very low BMI values, the probability of diabetes is very low. And now finally to conclude, BMI is a strong predictor of diabetes, but in this sample, the statistical significance is very weak because the p-value is 0.3, which is more than 0.05. And now coming to the last category of the statistical test, that is survival analysis. So under this, the first test is the Kaplan-Meier curve. So it is used to estimate and visualize survival probabilities over time. So in this test, the dependent variable is the time, that is time to event, or survival time in months, for example. and the independent variable can be categorical. A very simple example, studying the survival of TB patients under different treatment regimens over 10 months. So two treatment groups are standard and new drug. Okay, and the censored status is survived or died. So the first step in SPSS is to select the variable view. Enter all variables, select the data type, select the decimals, label names and the value labels. So for treatment group, 1 is for standard and 2 is for new drug. For censored status, the coding is 0 for survived and 1 for died. Then we need to select the measurement scale. So it's very easy, nominal for ID as usual and nominal for treatment group and censored status because the coding is 1 and 2, 0 and 1. But for survival time, so time is a continuous variable. So the measurement in this case is scale. Then click on data view, enter all data, click on analyze, select survival, then select the Kaplan-Meier test. Then we need to pull survival time to the time box and the censored status to the status box and the treatment group to the factor box. Okay. Then we need to define event for status box. So what is the event in this case? That is 1, that is died, right? So that is considered as event. So we need to give the code 1 in this case. Then click on OK. Then click on options. Then we need to tick the survival. Then click on continue, click OK. Then you will get the results. So now let's try to interpret the results. So if you can look at the results graph, the standard treatment group shows a higher survival rate. That is the blue line with only 1 death occurring at 8 months. Whereas the new drug people experienced multiple early deaths with 80% of patients dying by the 8th month. So what does it indicate? The standard treatment is more effective in prolonging survival, while the new drug may be less effective or have adverse effects leading to early mortality. Okay. So now coming to the next test, that is Cox regression. It is used for survival analysis to examine the effect of predictor variables on the time until an event occurs. What is time until an event occurs? A simple example, death or disease progression. So in this case, the dependent variable is again similar to that of the Kaplan-Meier curve, time to event. But the independent variables can be categorical or continuous. So very simple example, a researcher wants to study the effects of smoking, exercise and BMI on the time until a heart attack occurs in 10 individuals. Okay. So you can see the variable names in the columns, right? Age, smoking, exercise, BMI, time to event and the event. So what is the event in this case? It is heart attack. So the coding is 1. So the first step we need to do in SPSS is to click on variable view, enter all variable names, okay, and select the SPSS data type, decimals, label names and value labels. Okay. For smoking status, 1 for yes and 0 for no. Exercise status, it is 1 for yes and 0 for no. And coming to the event, if the event happens, it is 1, that is yes, and 0 for no. And also select the measurement scale. For ID, it's nominal. For age, we know it's a continuous variable, so it's scale. For smoking status, again, yes or no type of question, categorical, nominal. Exercise status is also yes or no, again it is nominal. And coming to BMI, again we know it's a continuous numerical variable, so it is scale. And time to event is scale, and again event is nominal because it is 1 if the event happens and 0 if the event is not occurring. Okay. And now click on data view and enter all the data. Click analyze, select survival and select the Cox regression. Then we need to pull the time until heart attack into time box, heart attack occurrence to the status box. Then we need to define the event because we know event is the occurrence of a heart attack, right? But we have coded it as 1. So we need to put 1. Then we need to pull the smoking, exercise and BMI to the covariates box. Then click on OK and you will get the results. So now let's try to interpret the results. First we need to look at the coefficient. Okay. The B value is 0.648. It is positive coefficient and it indicates that smokers have a higher risk of experiencing a heart attack sooner. And now coming to hazard ratio, that is exponential of B, the value is 1.9. So what does it mean? It suggests that smoking nearly doubles the risk compared to that of non-smokers because it is almost 1.9 is nothing but 2, right? So it doubles the risk compared to non-smokers. And now coming to exercise status, the coefficient is minus 1.6. Minus indicates a negative relationship, but if you look at the p-value, it is not significant because it is more than 0.05. So next coming to BMI, again the B value is 0.8, but the P value is again not significant. And now coming to omnibus test, the p-value is significant in this case because it is 0.006. So what does it indicate? The model is statistically significant overall. At least one of the predictor variables significantly contributes to predicting the risk of a heart attack. And to finally summarize this, the effect of exercise, BMI and age are not statistically significant in this data set. So for better understanding, I have collected some articles where they have used different statistical tests. So first we will start with the descriptive statistics. Okay. So in this article, if you can look at the data analysis part in the methodology section, they have clearly mentioned that quantitative data were analyzed using descriptive statistics. So we already know that descriptive statistics are used to summarize the data. So where we can see the mean, standard deviation, etc. Right. So this table shows us the descriptive statistics of the study. And now coming to independent t-test, and if you can look at the title, adolescent to parent violence, psychological and family adjustment. So in the data analysis section, they have clearly mentioned that for the continuous variables, the comparison of the means between groups was performed using t-test. So we already know t-test is to compare the groups, right? Compare the means between groups. So if it is on the same sample, we call it as paid t-test. And if it is between two groups, we call it independent sample t-test. Okay. So this is the t table and you can check for the p-values. Okay. So 0.4, 0.08 and 0.16. So based on that, we can say whether it is statistically significant or not. And now coming to paid t-test, and we already know it is between before or after an intervention. So the title is a pre-experimental study to assess the effectiveness of structured teaching program on knowledge regarding polycystic ovarian syndrome among the adolescent girls in selected senior secondary school of Haryana. So it is basically after and before the teaching program, right? So now if you can look at the table, so clearly you can see the paid test p-values on the right side. So the p-values we can see 0.000. It's almost significant in all the cases, okay? So this shows that the pre-test mean score and HT was 11.5 plus or minus 1.9. And the post-test mean score and HT was 19.97 and 2.2. So there is definitely an increase in the mean, right? From 11.5 to 19.97. So the calculated paid t-test value is 23 and which is more than the t-table value of 0.001 significance. So that is statistically significant. So they said that structured teaching program was effective in increasing the knowledge. And now coming to the next test, that is Mann-Whitney test. So the title is Intake of Ultra Processed Food, Dietary Diversity and the Risk of Nutritional Inadequacy Among Adults in India. So if you can look at the abstract, they have clearly mentioned that Mann-Whitney test was used to assess differences in risk of inadequacy across gender. Okay. So it is a non-parametric test which is alternative to independent t-test. Okay. So everything is same, but we use it in case of non-normally distributed data. And now coming to the next test, that is Wilcoxon sign rank test, which is an alternative to paid t-test, right? So the title is Effectiveness of First Aid Training, Engaging Community Stakeholders in Rural India. So if you can look at the abstract, they have clearly mentioned that the improvement in the knowledge was assessed by using the Wilcoxon sign rank test. So the sample is same, but it is done before and after, similar to that of paid t-test. But the condition is that the data should be non-normally distributed. And now coming to the next test, that is one-way ANOVA test. As we already know, we use it when there are more than 2 or 3 groups, right? So if you can look at the abstract, it is clearly mentioned one-way ANOVA was performed to identify significant differences in mean neonatal mortality rate. So if there is any between states and union territories. So you can look at the result section also. This is the table of ANOVA and you can look at the value of F, that is 3.9. But if you can look at the P value, that is 0.0294. So it is less than 0.05. So it is statistically significant. And now coming to the next test, that is Kruskal-Wallis test. It is an alternative to ANOVA test, right? In case of non-normally distributed data. So the title is Knowledge, Attitude and Practice Regarding Oral Health Among the Rural Government Primary School Teachers of Mangalore. So now let's look at the abstract. In the method section, comparison of knowledge and attitude among the 3 age groups was done with Kruskal-Wallis test. Okay, so you can see the test results also. So in this case, you can look at the p-value. It is 0.017. So that means it is statistically significant. Okay, And now coming to the next test, that is chi-square test, and we already know it is done to look for the association between the categorical variables. So the article title is Smokers' Characteristics, General Health and their Perception of Smoking in the Social Environment. So if you can look at the methods, it was very clearly mentioned they have used chi-square test, and you can look at the results of the test also. So if you can see, the chi-square value is something 160 and the p-value is 0.000, which is less than 0.05, and we can say it's statistically significant. And now coming to the next one, that is linear multiple and logistic regression. The title of the article is The Positive Association Between Physical Activity and Alcohol Use in African American Adults. So if you can look at the results section, you can clearly see they have used multinomial logistic regression to assess the relationship of physical activity with alcohol use categories. And also you can see a table for linear regression analysis to assess the relationship of alcohol use and physical activity with body mass index. And now coming to the next one, that is Pearson correlation. The title is The Correlation Between Rates of Cancer and Autism. So in this case, they have used Pearson correlation for autism rates and the incidence of specific cancers. Okay. And now coming to the next study, that is Spearman's rank correlation. The title is Socio-demographic Characteristics of Diabetic Hypertensive Patients Presenting to a Tertiary Care Hospitals. So if you can look at the abstract, it was very clearly mentioned. Spearman's rank correlation, which indicates the relationship between the duration of the disease with socio-demographic characteristics of the patients. And now coming to the next test, that is Kaplan-Meier curve. We already know that it is used for survival analysis, right? In this case, the dependent variable will be time in months or the survival time, right? And also we have discussed about the graph also, blue and orange line, which indicates two different groups. In our case, it was new drug and the standard drug. Okay. So similarly, in this case, the title is Evaluating COVID-19 Vaccine Efficiency using Kaplan-Meier Survival Analysis. Okay. So you can go through it. And now coming to the next one, that is Cox regression. The title is A Clinical Prediction Model of Overall Survival for Patients with Cervical Cancer aged 25 to 69 years. So if you can look at the abstract, so it was mentioned that we first performed the multivariate Cox regression analysis to evaluate the predictive values of the variables. Clear. So now if you can also check the results also. So they have given the p values on the right side. You can check that. So based on that, we can say whether it is significant or not. And now coming to the last part of the video, that is conclusion. I hope you have learned something new related to statistical tests or the SPSS. But if you ask me, is this all about SPSS? Definitely no. There is so much to learn and learning never stops, right? But this video can give you a very strong foundation in SPSS for public health. So you can apply any statistical test to any data set, no matter how complex it seems. So my approach is simple. Master the basics and don't stress about the rest. Always try to focus on understanding how to interpret the results. Okay. So it's okay to make mistakes also. I have made plenty myself. And I might have even made some mistakes in this video today, but that's how we learn, right? So practice more and try to improve every day. And I hope this video helped you understand the basics of SPSS and when to use a statistical test, how to run it in SPSS, and how to interpret the results, which is very important. And stay tuned for more videos on my channel. Thanks for watching.